In this video, I will walk you through why your doctor ordered you a Spinalogic bone growth stimulator, what insurances cover Spinalogic, how to use your stimulator, and answer some common questions we get from patients. Let's get into it. To start off, why did your doctor order you the Spinalogic bone growth stimulator? To put it simply, your doctor ordered it for you to help accelerate your body's natural healing process and shorten your recovery time after spinal fusion surgery. The Spinalogic stimulator uses a patented electromagnetic frequency called a combined magnetic field, or CMF for short, to target your body's bone-building cells, or osteoblasts. This non-invasive therapy causes your bone-building cells to send out a signal that recruits more to the site of your fusion surgery. With more bone-building cells present, your body is able to build more bone and help your spine fuse faster than it otherwise would. In fact, in a recent study, patients that were given the Spinalogic stimulator healed 78 days faster than patients that didn't use a stimulator at all. In that same study, the patients that used the Spinalogic bone growth stimulator healed 75 days faster than patients that used the OrthoFix bone growth stimulator and 42 days faster than the patients that used the Zimmer Biomet bone growth stimulator. It's also worth noting that the Spinalogic device only has a 30-minute treatment time, whereas the OrthoFix treatment time is 4 hours a day, and the Zimmer Biomet device has a recommended wear time of 24 hours a day. Now that you know how the Spinalogic stimulator works, let's look at insurance coverage. The Spinalogic stimulator is covered by Medicare and the majority of commercial insurance providers and workers' comp providers. Medicare authorizes bone growth stimulation therapy in 3 scenarios, and most commercial payers follow Medicare's guidelines. The first and most common scenario Medicare will authorize the device for is after a patient has underwent a multi-level spinal fusion surgery. Medicare defines a multi-level spinal fusion where 3 or more spine vertebrae are being fused. For example, an L3 to L5 fusion. Scenario number 2, Medicare will cover the Spinalogic bone growth stimulator if a patient undergoes a revision spine surgery. For example, if the patient had a previous L4 to 5 spinal fusion and now they need their L4 to 5 fusion revised because perhaps their implants broke from a fall. The final scenario where Medicare will cover the Spinalogic bone growth stimulator is pseudoarthrosis. A pseudoarthrosis is a long word for delayed healing, and according to Medicare guidelines, if a doctor determines the patient is still not healing after 9 months, then Medicare will approve a bone growth stimulator. Insurance coverage can be confusing, so your Spinalogic rep will work closely with you and your insurance provider to obtain pre-approval and authorization and make sure you understand exactly what your plan covers. Once your Spinalogic device is approved, your rep will coordinate a time to deliver the stimulator to you and teach you how to use it. To begin, your rep will familiarize you with the contents within the CMF stimulator carrying case. Inside the case, you will find the Spinalogic stimulator and attached control unit, replacement batteries, and a patient instruction manual. Your rep will point out that instructions on how to operate the device are located on page 7 of the instruction manual. Your representative will leave their business card or contact information within the instruction manual. If you ever have a question about how to operate or troubleshoot your device, please don't hesitate to contact your rep. Your rep will then guide you through the layout of the stimulator and point out the key sections of the device. The stimulator unit itself is oval and includes the stimulating coil contained within the plastic casing, a Velcro waist belt, and removable Velcro pillow. The control unit is the handheld portion that connects to the stimulator via a cable, and it consists of an LCD screen and a button. The control unit allows you to turn your stimulator on, check your treatment record, and tells you when it's time to replace the battery. Once you are familiar with all of the contents of the carrying case, your rep will instruct you on how to apply the stimulator. To apply your Spinalogic bone growth stimulator, you first place the center of the oval stimulating coil over your fusion site on your back. Next, use the Velcro waist belt to secure the stimulator comfortably around your body. It is okay to wear the stimulator over clothing and bracing. Once the stimulator is in a comfortable position, use the control unit to turn on the device by pressing and holding the button on the control unit until you hear a beep, which will be about 3 seconds. The 30-minute treatment countdown will now begin and appear on the screen. You can use the clip on the back of the control unit to attach it to the waist belt. It is important to note that you will not feel anything during the stimulation therapy. Once the 30-minute treatment is over, the treatment complete icon will appear as a smiley face on the screen, and the device will beep twice and shut off. We recommend that patients wear their device at the same time each day so they can maximize the effectiveness of the therapy, and this also helps provide a reminder that every time you grab that cup of coffee in the morning or watch the news in the evening, you put your bone growth stimulator on. Another thing that you can do is check your treatment record by pressing the button once without holding it down. The screen will show 2 numbers. The number on the left is the number of treatments you've had, and the number on the right is the number of days since you first used the device. From the first day you use the device, it will work for 270 consecutive days, or 9 months. We instruct patients to wear the stimulator for the full 9 months unless instructed otherwise by their doctor. The Spinalogic will not allow you to wear it more than once in each day, so if you go to turn it on for the second time, it will just show a smiley face and turn off. When it's time to replace your battery, the screen on your control unit will show a picture of a low battery sign when you go to turn it on. The carrying case contains 10 additional 9-volt batteries for your use. Remove the battery cover from the backside of the control unit and install the battery as shown. Then, replace the battery cover on the control unit. Your device is now ready for use. Please only use batteries supplied by DJO rather than lithium batteries or store-bought batteries. If you run out of batteries, contact your rep and they will help supply you with more. Since the Spinalogic bone growth stimulator is indicated for just a single patient use, the stimulator is not reusable and cannot be resold or used on multiple patients. When you've completed your treatment, you can bring your device to a nearby electronic recycling facility. Often stores that sell electronics can take them and recycle them for you. The final step is to sign the paper or electronic patient agreement form provided by the rep. By signing, the patient acknowledges that they have been properly educated on the device and they understand their financial responsibility if there is any. Before leaving, your rep will check one last time to ensure you don't have any questions about how to operate your Spinalogic device. They'll also double check that you know how to get in contact with them if any questions do come up in the future. At Optimus Surgical, we take great pride in providing excellent customer service to patients, and we are humbled by the number of 5-star reviews we have received from patients. We will make every effort to ensure you have a 5-star experience and recover quickly after your spinal fusion surgery. We look forward to helping you.